Kathy Schneider with SRC and Aetna Company. I'm the head of sales, and I have been with SRC for 18 years. SRC is an Aetna company. We were acquired in January of 2005, so I am an Aetna employee. It is a wholly owned subsidiary of Aetna. And I'm here today as part of the voluntary benefits conference, because that's obviously what we do. Is we had specialized in limited medical, but also in voluntary solutions around offering products to employers with high turnover populations. But it fills gaps for people in terms of their coverage. So from an employer standpoint, it's a tool for recruitment and retention. For an employee or consumer standpoint, it's the availability of products to be able to meet varying needs across different populations at different periods in their life. I think that right now is an especially important time in the evolution, if you will, of products that are being offered in employers' workforces. I was on the employer side for 10 years before I joined this company, and really can feel for some of the things that they're going through in terms of balancing the costs of benefits and yet still being able to offer something that's going to meet the needs of their employee population. So I think it's a really interesting evolution right now in terms of how employers look at their plans, reevaluate whether or not they're meeting the needs of their employees, and offering some really unique, interesting products that better fit the lifestyles of the employees that are employed with them. We started with limited medical, so that's kind of the perspective that I had. And it was to provide a safety net for employees that didn't have access to their employer's core medical plan. So whether it was part-time, seasonal, waiting period, it was to fill the gap for employees that didn't have coverage available to them elsewhere on a group, voluntary, affordable basis. And so given that that's kind of the background from where we're coming from, and given healthcare reform at this point in time, we have evolved into filling different gaps for employees with different types of products. So I still think right now, and especially in this economy, that limited medical product is still a really important one in terms of a solution for an employer that's struggling with offering medical benefits to their employees. As healthcare reform discussions progress, we don't know where that's going to go, but I think it's still around offering solutions with perhaps event-based medical products or ancillary products such as dental, vision, short-term disability, long-term care, and short-term disability products. So that's it's changing. If you were to ask me right now, I still think there's a big void with the medical product, where there's still a lot of employees that aren't eligible for medical insurance on an affordable basis. As healthcare reform changes it, though, I think it just lends itself very well to creating solutions around different product sets. I think that as we are evolving into creating solutions, it requires us not only to create products, but services that are going to help employers be able to offer these benefits to the employee populations that maybe perhaps were previously uninsured. So I think the big vision, if you will, in terms of where we'd be headed is around healthcare literacy, making sure employees understand the choices, if they're given different choices now than they had been previously, understand how it best can suit their lifestyles or their immediate needs to fill certain gaps in coverage, and then just provide a service from the employer. And that's a really important thing, I think, is to provide a service to an employer so they are comfortable with continuing to provide benefits that meet the employee's needs.